Hello, I'm Dr. Caleb Sterling, and I'm so glad you're here today. If you're over 60 and you've noticed that your hands and feet are getting colder, or maybe they're always feeling numb, or they change colors when you're out in the cold, you're not alone. This is something I see in my practice almost every single day. Cold hands and feet are one of the most common complaints I hear from patients in their 60s, 70s, 80s, and beyond. And here's the thing that frustrates people the most. They don't understand why it's happening. They think it's just a normal part of getting older. But I'm here to tell you, it doesn't have to be this way. Today, I want to share with you something that's helped dozens of my patients improve their circulation quickly. Some within minutes, some over a few weeks. And the best part? It's simple. It's natural. And it's something you can do in your own home with just 1 cup of something most of you probably already have. But before we get to that solution, let's talk about what's actually happening in your body when your circulation isn't working the way it should. You know, when we hit 60 and beyond, our bodies change in ways we don't always talk about. One of those changes is what happens to our blood vessels. Our arteries, the tubes that carry blood from your heart to the rest of your body, they start to stiffen up. It's kind of like a rubber hose that's been sitting in the sun for years. It doesn't stretch and flex the way it used to. This happens because a few things are going on at the same time. First, your body produces less nitric oxide. Now, nitric oxide is a chemical messenger in your body that tells your blood vessels to relax and expand. When there's less of it, your blood vessels don't open up as wide, so less blood can flow through. Second, the inner lining of your blood vessels, we call it the endothelium, it gets more fragile. It doesn't respond to the signals your body is sending as well as it did when you were younger. And third, your blood gets thicker over time. I know that might sound strange, but it's true. Your red blood cells can become less flexible, and your blood can become more viscous. When blood is thicker, it doesn't flow as easily. It's like trying to drink a milkshake through a regular straw instead of a thick smoothie straw. It just doesn't move as fast. All of these things together mean that when you're over 60, your circulation is naturally challenged. And when circulation isn't good, your extremities, your hands and feet, they're the first places to feel the effects because they're the farthest from your heart. Let me explain this in a way that makes sense. Your heart is like a pump. It pumps blood out to your entire body, all the way to your fingertips and your toes. The blood carries oxygen and nutrients. When the blood gets to your extremities, it delivers those nutrients. Then it travels back to your heart to get pumped back out again. Now here's the problem. When your circulation is sluggish, when your blood vessels are stiff and your blood isn't flowing as freely, your hands and feet don't get as much blood flow. And when you don't have good blood flow to your hands and feet, they get cold. They might look pale. They might even turn a bit blue or purple when you go outside in the cold. Some of you might notice that your feet are cold at night, or your hands are always cold, or maybe you have this weird thing where your fingers turn white or blue when you're stressed or cold. That's called Raynaud's phenomenon, and it's actually more common in people over 60 than most people realize. But here's the good news. Cold hands and feet aren't just a sign that your circulation is slowing down. They're also a signal from your body that you need to do something about it. And the fact that you're here watching this means you're ready to take action. Now I'm going to tell you about something that's been studied for over 20 years. And what the research shows is pretty remarkable. It's a simple beverage that can actually improve your circulation within minutes. Some people feel the warmth spreading to their hands and feet within 10 to 15 minutes. Others notice a change over a few days of consistent use. What is this miracle drink? It's ginger tea. Now, I know some of you are thinking, Dr. Sterling, ginger tea? Really? But before you dismiss this, let me tell you exactly what ginger does in your body and why it works so well. Ginger contains something called gingerols and shogaols. These are active compounds that have powerful effects on your circulation. When you consume ginger, these compounds work in several ways. First, they help improve blood flow by making your blood vessels more flexible. Second, they reduce inflammation in your blood vessel walls. And third, and this is important, they help thin your blood slightly, making it easier for blood to flow through those narrowed pathways. Studies have shown that ginger can increase circulation by up to 20% within just 30 minutes of consumption. And if you use it regularly, you can see cumulative improvements. People who drink ginger tea every day for 4 weeks often report warmer hands and feet, better energy, and less numbness and tingling. But here's the key. You have to make it the right way. Not all ginger tea is created equal. If you just buy a ginger tea bag from the store, you're not getting nearly enough of the active compounds. You need fresh ginger, and you need to prepare it properly. Let me walk you through this step by step. This is so simple, and I want you to start doing this today. First, you're going to get fresh ginger root, not powdered ginger. Fresh ginger. You can find it in any grocery store, usually in the produce section. It looks like a light brown knobby root. You want a piece about the size of your thumb. Next, wash your ginger under cool water. You don't need to peel it. Some people prefer to peel it, but the skin actually contains a lot of the beneficial compounds, so I recommend leaving it on. Now slice your ginger into thin slices, about 1/4 inch thick. You want about 8 to 10 slices per cup of water. Put 1.5 cups of water in a pot and bring it to a boil. Once it's boiling, add your ginger slices. Let it simmer for about 10 to 15 minutes. The longer you simmer it, the stronger the brew will be. Some of my patients let it go for 20 minutes for a really potent tea. While that's simmering, here's where you can personalize it. You can add a squeeze of fresh lemon juice. Lemon also has circulation boosting properties. You can add a small piece of fresh turmeric root if you have it. You can add a tiny pinch of cayenne pepper. Cayenne is actually one of the best circulation boosters there is. Just a pinch. You don't want it too spicy, but that little bit of heat will really activate circulation. Some people add a small piece of fresh garlic. Now, garlic is incredibly powerful for circulation. If you can handle the taste, add 1 or 2 thin slices of fresh garlic to your ginger tea. Your body will thank you. When you're ready, strain out the ginger and the other pieces. Pour it into your cup and let it cool to a drinkable temperature. I recommend drinking this while it's still warm, not piping hot, but warm, because the warmth itself helps dilate your blood vessels. You might be wondering why this works so quickly. How can you drink a cup of tea and feel warmer within minutes? The answer lies in how your body absorbs these compounds and how quickly they start working. When you swallow ginger tea, it doesn't have to go through your digestive system for hours before it takes effect. Ginger is absorbed very quickly through the lining of your mouth and throat and down your digestive tract. Within 5 to 10 minutes, the active compounds are already in your bloodstream and they're starting to work. These compounds immediately begin signaling to your endothelial cells. Remember, those are the cells that line your blood vessels, telling them to relax and expand. This happens through a pathway involving nitric oxide, which is exactly what your aging circulation needs. At the same time, ginger is reducing something called inflammation markers in your blood. Chronic inflammation is one of the biggest culprits in poor circulation after 60, and ginger is one of the most anti-inflammatory foods you can consume. Plus, the warmth of the tea itself is causing vasodilation. That's the fancy term for your blood vessels opening up. So you're getting multiple mechanisms working together at once. That's why it works so fast. When you first start drinking this ginger tea, you might notice some changes right away. Many of my patients tell me that within the first week, they feel warmer. Their hands aren't as cold. Their feet don't feel quite as numb. Some people notice that they have more energy. That's because better circulation means more oxygen is getting to your muscles and your brain. A few people might notice that they feel slightly lightheaded or a little bit flushed when they drink it, especially if they add cayenne. That's actually a good sign. It means circulation is improving. Just start with smaller amounts if that happens, and work your way up. You might also notice that you sleep a little better. That's because poor circulation often contributes to restless sleep and nighttime leg cramps. When circulation improves, sleep often improves too. Now I want to be clear about something. This isn't a magic cure. If you drink 1 cup of ginger tea and then go back to your normal habits, the effects will wear off. But if you drink this consistently, even just once a day, preferably in the morning, you will see sustained improvements. Here's what I recommend. Start with 1 cup per day. The best time is in the morning because you want that circulation boost throughout your day. If you're tolerating it well after a week, you can increase to 2 cups a day, 1 in the morning and 1 in the afternoon. Some of my patients who really notice the benefits drink 3 cups a day, but I don't recommend more than that. And I definitely don't recommend drinking it right before bed because the circulation boost might interfere with your sleep. Consistency is more important than quantity. 1 cup every single day will give you better results than 3 cups sporadically. Make it a habit, just like your morning coffee or tea. And here's something else. If you're over 60 and you have poor circulation, you probably need to do more than just drink ginger tea. This is one piece of the puzzle. The other pieces include movement, hydration, and diet. While you're drinking your ginger tea, you need to be moving your body. Sedentary lifestyle is one of the biggest circulation killers. Even 20 to 30 minutes of light walking every day can dramatically improve your circulation. Walking gets your heart pumping, which pushes blood out to your extremities. It also strengthens the walls of your blood vessels over time. If walking is difficult for you, that's okay. Even light movement, stretching, tai chi, water aerobics, all of these help improve circulation. Second, you need to be drinking enough water. Dehydration makes your blood thicker, which makes circulation worse. If you're over 60, you should be drinking at least 8 glasses of water a day, probably more. And when you're drinking ginger tea, that counts toward your hydration. Third, your diet matters. If you're eating a lot of processed foods, a lot of saturated fat, a lot of refined carbohydrates, your blood vessels are probably inflamed and your circulation is suffering. Start incorporating more foods that naturally improve circulation. Garlic, onions, leafy greens, berries, fatty fish with omega-3s. These are all circulation boosters. And fourth, manage your stress. I know that's easier said than done, but chronic stress constricts your blood vessels. When you're stressed, your body releases cortisol, which causes inflammation and makes blood vessels tighter. Find ways to relax, meditation, deep breathing, spending time in nature, whatever works for you. Now, I need to mention a few important things. If you're on blood-thinning medications, like warfarin or aspirin, you should talk to your doctor before you start drinking ginger tea regularly. Ginger has mild blood-thinning properties, and we want to make sure there's no interaction. If you have a bleeding disorder, same thing. talk to your doctor first. If you're pregnant or nursing, you should also check with your healthcare provider before starting ginger tea regularly. And if you have gallbladder problems or you're prone to kidney stones, you might want to limit ginger because it can affect bile flow and mineral balance in some people. But if you're a healthy person over 60 with poor circulation and no major health conditions, ginger tea is safe and beneficial. Let me tell you about a couple of patients of mine so you can see how this works in real life. Margaret is 72 years old. She came to me complaining that her hands were always blue. She was embarrassed about it. She didn't want to hold hands with her grandchildren because her hands were so cold. Within 1 week of drinking ginger tea every morning, she noticed a difference. Within 3 weeks, her hands were pink instead of blue. She told me it was life-changing. Then there's Robert, who's 68. He had numbness and tingling in his feet all the time. He was starting to worry that something serious was wrong. He started with the ginger tea and also started walking 30 minutes a day. Within 2 weeks, the numbness was almost completely gone. 6 weeks in, he said he felt like his circulation had improved by 50%. These aren't outliers, these are typical results. Here's something I recommend. Don't just drink your ginger tea sitting down. Drink it while you're moving. Ginger tea plus movement creates a synergistic effect that's more powerful than either one alone. So make your ginger tea, then go for a 10-minute walk. Let the ginger work on your blood vessels from the inside while movement is pumping your heart from the outside. This combination is incredibly effective. Or do some gentle stretching while you sip your tea. Do some tai chi. Do some yoga. Any movement counts. If you commit to drinking ginger tea every day and moving your body and eating well, you're not just treating the symptoms of poor circulation. You're addressing the underlying problem. You're actually reversing the damage that time and a sedentary lifestyle have done to your blood vessels. Over 3 to 6 months of consistent ginger tea use plus lifestyle changes, many of my patients see remarkable improvements in their circulation. Their hands and feet stay warm, they have more energy, they sleep better, they feel better overall. And here's the thing, these improvements stick around because you're not taking a medication, you're not relying on something artificial, you're tapping into your body's natural ability to heal and improve. Once your circulation gets better, it wants to stay better. Here's what I want you to do, starting today, not tomorrow, today, I want you to get fresh ginger root from your grocery store. Get one piece about the size of your thumb. Tonight, make yourself a cup of ginger tea the way I described. Drink it while it's warm. Pay attention to how you feel. Tomorrow morning, make another cup. Drink it, then go for a walk. Even if it's just around your house or around the block. Move your body for 10 to 20 minutes. Do this every single day for 2 weeks. That's 14 cups of ginger tea. 14 walks or movement sessions. In 2 weeks, I want you to notice how your hands and feet feel. Are they warmer? Is the numbness better? How's your energy? After 2 weeks, if you're noticing improvements, and most people do, commit to it for 3 more weeks. Make it a 6-week experiment. 6 weeks of consistent ginger tea and movement. That's when you'll really start seeing major changes. And if you're part of a family, get your whole family doing this. Your kids and grandkids might not have circulation problems, but everyone benefits from better circulation, better energy, better sleep. I know that cold hands and feet might seem like a small thing. You might think, well, I'm 65 years old, that's just what happens. But I'm telling you, it doesn't have to be that way. Your body still has the ability to improve. Your blood vessels can still respond. Your circulation can still get better. It doesn't require expensive medications. It doesn't require invasive procedures. It requires commitment to a simple daily habit. 1 cup of ginger tea, some movement, and the willingness to believe that your body can heal. I've seen it happen hundreds of times. I've seen people in their 70s and 80s completely transform their circulation and their quality of life. You can too. So, start today. Make that ginger tea. Take that walk. Feel the warmth returning to your hands and feet. And let me know how it goes for you. Thank you so much for watching. If this video has been helpful, please like it, subscribe to the channel, and share it with someone you love who might be dealing with cold hands and feet. Leave a comment below and tell me your story. I read every single comment and I love hearing about your progress. And remember, you're not too old to improve. Your body is capable of amazing things. You just have to give it the right tools. I'm Dr. Caleb Sterling, and I'll see you in the next video.